Hi, everyone. I'm Dr. Aylah Clark, and I'm going to be doing a talk tonight on polycystic ovarian syndrome, or PCOS. Um, and I think I will go ahead and jump into it. So, if you haven't been to our office before, here's a few pictures of Whole Health Wellness Center, and we are in Avon, Connecticut. And we see all kinds of conditions, but hormone conditions, especially things like PCOS, are pretty common in our practice. It's overall a pretty common condition. And I think it lends itself well to naturopathic medicine because there are a lot of different things we can do that go beyond the conventional treatments. And we hear this type of thing a lot where people have been told that their labs are normal and kind of feel like you're on your own to figure it out from there. And this is a perfect opportunity for us to help you out. There's often so much more you can do, and we'll be talking about a few of those things. So tonight, I'm going to talk about kind of some background, just symptoms and diagnosis of PCOS, some fertility considerations, nutrition in PCOS and some of the research there, treatment options, including the conventional options, as well as some of our approaches, and what you might do from here. So PCOS can present differently in different people. Not everybody has all of these symptoms. In fact, rarely do people have all of these symptoms. But most commonly, people do often have irregular periods. Sometimes people have insulin resistance. That's one that can be a very strong feature in some people, and other people may not have any signs of insulin resistance, which is when your blood sugar is more likely to be a little elevated. It's often harder to lose weight. So that's the next bullet, is difficulty losing weight and obesity, which goes along with that. Hirsutism, which is when you maybe have hair where you don't want it, like increased facial hair, and that has varying degrees of severity. Some people have hair loss, and certainly you could have painful periods. You could have bloating because of the cysts on your ovaries. Some people have really heavy or prolonged periods where you may not have a period or you may have a prolonged bleeding where you could have a period for a long time, versus irregular menses, which generally could mean, and it often means in PCOS, that you have less frequent periods, so greater than 35-day cycles. And acne can also be an issue, and along with insulin resistance, you can have high blood sugar, as I said, high triglycerides, and high cholesterol in general can sometimes be an issue related to it. But like I said, you don't need to have all of those. In fact, for a PCOS diagnosis, you only need 2 of 3 things, which is one of those things is those signs of high testosterone or elevated testosterone on your labs. Second would be cysts on your ovaries. And third is the irregular periods. So the interesting thing here, I think it's interesting that you don't actually have to have cysts on your ovaries to have PCOS, or polycystic ovarian syndrome. But one really important thing about this is that you really have to rule out other causes. There are several things that can cause similar symptoms to PCOS, and very commonly, I really don't see that they've been ruled out, or people have had those labs or those tests done at the wrong time of the month or the wrong time of day, where it's unlikely to actually pick up those diagnoses. So I always like to make sure we really have ruled out those other causes of those symptoms, and that's when we can start calling it PCOS. A lot of patients ask me, why is this happening? What can I cure it? And we really don't know all the underlying reasons why PCOS happens, but right now the research has been showing that it's probably a few things going on. There's usually several genetic factors at play, and also epigenetics, which is when environmental factors influence the way your DNA is expressed, and also other environmental influences. And one of those ways that the environment can affect your PCOS risk is actually in prenatal exposures to endocrine disruption. So I'm going to go through that in a little more detail on the next slide or two. So this was one study that was talking about prenatal exposure to endocrine disruptors and how that influences the risk of PCOS. And they've done this in both animal studies and human studies. And basically, it has shown that this does indeed occur. And it can actually be multi-generational, because as a fetus is developing, if there are ovarian cells developing in that fetus, then those are the ovarian cells that are going to be there for the rest of the fetus's life. And so it actually does have effects through generations, even when the mother is exposed. So here's a few more studies on here too. So endocrine disrupting chemicals, that's a big category. There are different classes within that category, like phthalates, phenols, perfluorinated compounds, PCBs, and organochlorine pesticides. They're all pretty common. They have been shown to cross the placental barrier. And so I'm going to talk about these other bullets too. So that in animal studies, they showed exposure to these compounds led to PCOS-like characteristics in that third generation. In humans, they did some studies on PCB exposure, and that showed implantation failure in IVF, which, if you're not familiar with, is one of the ways people overcome infertility issues, and it stands for in vitro fertilization. And then OCPs, which in this case stands for organochlorine pesticides, and hydrochlorobenzene also were shown to reduce implantation in IVF. Another study has looked more into triclocarban, or TCC, which is really widely used in soaps, carpets, plastics, toys, school supplies, even pacifiers. And it has been shown to amplify the effects of testosterone. And we also know that PFAS, or PFAAs and PFOS, these are all mouthfuls, are widely used in different industries, and those can also increase androgen exposure, which is those testosterones. So there's a lot to look out for, and you can reduce your exposure to some extent by avoiding drinking out of plastic water bottles, and avoiding microwaving in plastics, and being mindful about some of the exposure through like cleaning products and that type of thing, buying organic. But to some extent, we are going to be exposed to these. So I think limiting the exposure where you can be important. All right. So number 2, briefly, I wanted to talk about the fertility considerations in PCOS, because this can really impact people throughout their life, and important aspects of their life. So one of the main ways PCOS can impact fertility is that you may not ovulate regularly, and that can be a problem for a couple reasons. One is if you're not ovulating regularly, it may reduce your windows in which you can get pregnant, because you need to time intercourse during that ovulation window in order to get pregnant, and it would be happening less frequently for some people with PCOS. It also makes that a lot more challenging to time, because if you're only ovulating 4 times a year, then you have to, it's hard to figure out when that is. And so those are the main issues with that. Now, some people with PCOS think that because they're on a birth control and their period is now regular, that they don't have that problem. But it's important to know that actually does not mean you're ovulating regularly if your period is being kind of regulated by a birth control pill. It actually, you're not ovulating. So just something to know. And it's not saying that birth control is a problem. It can have its own benefits in PCOS. It can reduce cyst formation. It can help reduce the effects of testosterone and the symptoms related to that. But it's important, I think, to know what it is doing for you and what it isn't, especially in regards to fertility. So that doesn't mean that everybody has trouble with fertility with PCOS. I have plenty of patients who have PCOS and have gotten pregnant. So moving forward. So nutrition is absolutely foundational for PCOS. It is definitely not the cause of PCOS. For people, as we've discussed, there's lots of other underlying things going on, but it can impact the trajectory, because in general, people with PCOS often have issues with insulin resistance and tend to do better on a lower carb Mediterranean diet. And in some cases, taking that a little bit more extremely to a ketogenic diet, which is a very low carb diet and higher in fat and moderate protein. So keto, not everybody needs to do keto to see improvements in PCOS, and it's often not sustainable for most people. And as I said here, there's wrong ways to do keto, and there's right ways to do keto that can be a lot better for your heart health and a lot more sustainable. I'm going to talk about a few studies in regards to nutrition and PCOS as well. Here we go. So this is one study that was a low glycemic diet versus just a regular healthy diet. And I think that's important to distinguish, because if you go from a standard American diet to anything resembling healthy, if low glycemic is healthier than the standard American diet, then you're going to probably see improvements. But in this case, they were showing going to either a low glycemic diet or a regular healthy diet, meaning more balanced in the macros, proteins, carbs, and fats. And they did find that the low glycemic diet, which was more beneficial for PCOS than just the macro balanced diet. Now, the low glycemic diet is usually a little on the low carb side, and it's also mindful of food pairing. So you're often going to see carbs paired with proteins or fats to help blunt the blood sugar response and the insulin response. So that was one of them. And this is another study that was done on a ketogenic Mediterranean diet, which was a 12-week study. And this Mediterranean version of it means they were really leaning more towards the conventionally heart-healthy fats like avocado and fish and olive oil, and some lean proteins as well. And maybe not all lean proteins, probably, because you do want those fats in there. But but they did see significant improvements in all of the hormone parameters, so testosterone, but also progesterone, LH and FSH, which helps orchestrate the ovulation process, the whole menstrual cycle, and those were improved. And DHEA, which is an adrenal hormone, but it's a precursor to testosterone. They also showed improvements in cholesterol and insulin and blood sugar control as well, which we would expect. At least the insulin and glucose you might expect, but the cholesterol panel, I think, surprises some people that you can do a ketogenic diet and actually lower your cholesterol. And that's where I think the type of keto really does matter. All right, so this one was keto, but also directed a little bit more into fertility. And so this was over 6 months, and they did show that keto helped facilitate ovulation, and some women were able to become pregnant without additional fertility interventions that had previously had difficulty with pregnancy. And it's important to note, too, that in this study, they also took metformin, which can also affect your blood sugar and insulin resistance. So that one is interesting as well. It's important to note before I move on, though, that I think you have to be careful with doing keto around pregnancy. I think you really want to be monitored by a knowledgeable healthcare provider when doing that, and you may want to think about switching out of that once you become pregnant, because there are some nutritional concerns with that. But interesting nonetheless. Ground flax seeds are something I tend to recommend to most of my PCOS patients because it's an easy little thing to add in. And there's been a few studies over the years about flax seeds improving various things, skin aspects, including acne, the hair growth aspect, and improving lab markers like insulin and testosterone. This one did about 4 tablespoons a day, and I typically recommend ground flax seeds when I'm doing this because you're getting more of the fats that are found in flax seeds rather than just the fiber component. If you don't grind your flax seeds, you're really not getting as much of that fat, the good fats. All right, and I think that's it for nutrition. Yeah, okay. So treatments, you can do a combination of different treatments. You can do conventional and naturopathic treatments together. I think that is totally reasonable. Or you can choose one over the other if you want to, but I'm not going to talk a lot about conventional treatments because that's not generally what people are coming to us for. However, birth control is the #1 conventional treatment recommended in PCOS. And that, like I said before, can have some benefits. There can be some reasons to do that. But I also do think that there's been enough patients that were not completely informed about what the benefits were and what it wasn't doing for them, that when they, for example, started trying to conceive and then they realized they weren't really having a period for extremely long periods of time, they were taken off guard. So I think it's important to know be prepared that you may need some time to know your cycle after coming off of birth control if fertility is a goal for you. And metformin is another common recommendation for people that tend to have insulin resistance or blood sugar issues. And the others are a little less common, but some people that are really prone to the metabolic issues may be recommended statins or spironolactone for the acne or hair concerns, hair removal treatments, weight loss, etc. All right, so moving on to some other options. So we already talked about nutrition. As I said, that's foundational. But I wanted to really talk about the naturopathic approach because that is important. First of all, because the condition can really present so differently in different people, I really want to make sure that we're addressing the concerns that are most important to each person and that are most likely to benefit that person. So it needs to be individualized, and doing labs can really be helpful in understanding what the problem is. Hormone levels will be on there. That's especially testosterone, but we can look at a whole host of hormone levels, including thyroid, really making sure that's working well because that can influence PCOS. Metabolic markers like an insulin resistance score, in addition to the standard blood sugar, hemoglobin A1C. An insulin resistance score is less commonly ordered, but I find this to be incredibly useful. It was developed by Stanford, and it seems to be able to pick up a few more people that have a problem with insulin resistance that a hemoglobin A1C and a glucose doesn't. We might look at nutrient levels that can impact hormones or blood sugar control as well. Tailored nutrition, like I said, some people really do well on keto, but not everybody needs to do that. That the age of the person really can influence my decision making there too. If especially like young people don't need to be on extreme diets to manage this. You can do this with more sustainable and healthy options. So there's that. Exercise for sure. And then targeted evidence-based nutraceuticals. So these could be different supplements that have been shown to improve ovulation, improve blood sugar control, and if fertility is a concern, then we can do that stuff. So then we want to really monitor improvement by both the symptoms and also by rechecking these labs to make sure we're on the right track and we're doing what we aim to do. And I have a couple slides on some of these supplement recommendations. But because that's so individualized to the person and the labs and what we really need to be addressing, I didn't lay out a million of them here because not everybody that has PCOS needs to be taking a million supplements. So one of my go-tos is NAC. NAC stands for N-acetylcysteine. It's an antioxidant, and it's a precursor to a substance called glutathione, which is our major detoxification molecule. And so NAC is very liver supportive, and it can, from a naturopathic perspective, we also think a lot about your body's ability to metabolize hormones effectively. So that's one reason why we do this, but there's also an anti-inflammatory component to it. So NAC has lots of good benefits, and it's also really well tolerated, unlikely to have side effects to it. So this study was a review and meta-analysis of randomized control trials of 8 different studies. Overall, it included 910 women, and the NAC group, the treatment group, showed significant improvement in pregnancy and ovulation rates compared to placebo. And so typically, if you're ovulating more regularly, we're often seeing, therefore, more regular periods, and improvements in other symptoms that come along with that. This one, yeah, I think that's about it for that one. Berberine is another one. Berberine is the main active ingredient. Calling it an active ingredient, it seems extreme because it's from a plant. It's from a plant called Oregon grape, and it's one of the most well-known natural compounds out there. And this one was also a review of several studies, so 5 different studies, a total of 1,078 women, and they said that it had improved insulin sensitivity, quite like metformin. And some people tolerate berberine better than metformin as far as GI symptoms go. It also improved cholesterol, which sometimes I use it for that, completely separate to PCOS. And it also showed improvements of the ovulation rate per cycle. So they concluded that berberine was also effective on fertility and live birth rates. So berberine is generally safe, but you do kind of want to be monitored by somebody because it's not necessarily something I want people to be on forever, and it kind of depends on the person. But that's another favorite. Others I'll mention because I don't have additional slides on some of the other treatments, but inositol is another common supplement option for PCOS. There's also some different herbs like saw palmetto that we found to be very helpful for some of the testosterone-related symptoms. And yeah, so I wanted to at least give you a little flavor of those things. And that's it. So I hope this was an interesting talk for you. If you are interested in learning more or getting started on your own consultation for PCOS or anything else, feel free to schedule a free 15-minute consult with one of our team members and or schedule your first appointment, and make sure to check the chat, because if you do book something or a discovery call, then you can get a complimentary Theralite session, which is our red light therapy treatment, and it is a great anti-inflammatory treatment we use for lots of different conditions, and would probably be helpful. I don't know of studies of it in PCOS, but if you do have inflammation and or other reasons to use it, it can be a great little therapy. So have a good night, and hopefully I see some of you soon.